Welcome to the TubeClear clearing stem setup and instructional video. Watching this video does not substitute for reading the entire operator's manual before using the TubeClear system. Disregarding the cautions and instructions presented in the operator's manual constitutes abnormal use.
For this demonstration, I have already set up the control box and the clearing stem, and I have placed the depth limiter at 122 centimeters from the clearing stem's wire tip. To show you how the device works, I'm going to use a clear model so that you can see how the device breaks up a clog inside the feeding tube. While handling the clearing stem throughout the procedure, you may loosely coil it around your hand to help control the clearing stem's length. However, do not tightly coil the clearing stem around your hand or finger before or during use because this will slow the wire motion and decrease effectiveness. If you wrap too tightly, you will need to get a new clearing stem as it will kink and not work. To operate the TubeClear system, hold your patient's tube port in one hand while holding the clearing stem in the other. Holding your patient's tube allows for better control while inserting and removing the clearing stem from the patient's tube. Insert the clearing stem into the patient's tube a few centimeters. Press the Start-Stop button on the control box. Manually advance the clearing stem until you encounter resistance from the clog. Work on the clog using varying speeds of backward and forward motions. It is important to use backward and forward motions when moving the clearing stem through the tube because it will further help to break up and spread the clog content throughout the tube. For clogs you suspect are caused by medication, it is usually helpful to use quick, short forward-backward strokes. For clogs you suspect are caused by feeding formula or soft materials or feel sticky on the clearing stem, it is usually helpful to use long forward and backward strokes. However, do not apply excessive force on the clearing stem as this may kink the stem. Any sign of kinking due to your applied force will decrease the effectiveness of the stem. Now that I feel resistance from the clog, I'm moving the clearing stem backward and forward, trying to spread out the clog content while advancing into the clog further and further. You can see through my forward and backward motion that the clog has went from a concentrated shorter distance to be spread out through a further distance along the tube. If I have not easily made it through the entire clog in 1 to 2 minutes, meaning that I can advance my clearing stem until the depth limiter touches the external port, I will back the clearing stem in a controlled manner slowly out of the patient's tube so that I may aspirate and flush the content. Flushing with liquid and aspirating throughout the procedure helps to break up and spread out the clog and remove any declogged contents. Therefore, be sure to flush and aspirate every 1 to 2 minutes if the clearing stem is not easily advancing within the tube. To remove the clearing stem, hold the tube with one hand and slowly retract the clearing stem with the other hand. Allow no more than 10 centimeters or 4 inches between your hand and the tube's external port. If you allow a larger distance between your hand and the tube's external port, you may be introducing extra force onto the clearing stem, which may damage the clearing stem. After removal of the clearing stem, stop the control box by pressing the Start-Stop button. Do not detach the clearing stem from the control box at this time, as you may need to reinsert it into the tube if the clog is not yet clear. Place the clearing stem back in its packaging or use another clean technique while flushing and aspirating the tube. Flush and aspirate with an enteral syringe. If the clog does not clear during your attempt to flush and/or aspirate, reinsert the clearing stem into the tube and repeat the use of the TubeClear system until the clog is gone or the depth limiter reaches the tube's external port. Be sure to use backward and forward motions when moving the clearing stem through the tube. If the clog is not removed within 10 minutes, refer to the troubleshooting guide of the operator's manual. Also, note in some cases the clearing stem will advance through the clog, but the tube will not clear during the flushing and aspiration steps. This is commonly the result of the clog content reforming during the flush. If this occurs, simply reinsert the clearing stem and repeat use of the TubeClear system. Also, for more difficult clogs, it may be necessary to aspirate and flush throughout the clearing procedure several times before the clog is cleared.